Hello students, I am Dr. Saleha Jamal, faculty from Department of Geography, Aligarh Muslim University, Aligarh. So today's topic of discussion is climate change and its impact on health, part 2. If you remember, we have discussed in part 1 how climate change impacts human health, and we have also discussed some of the indicators which tells about the climate change and its impact on human health, and we have also discussed the direct and indirect ways how climate change is impacting the human health. So today in this class we will directly discuss about few of the indicators and their health impacts which is mainly affected by the climate change. So let us start the class, friends. Welcome to today's class. So first disease we are going to discuss today is the air quality and respiratory diseases. As we know, if there will be some problem in the air composition, if its ideal balance is being disturbed, then it will have some impact on the human health because we inhale oxygen, we are exposed to our surrounding atmosphere, environment, so certainly it will affect. When we talk about air quality and respiratory diseases, as it directly impacts the respiratory system because of inhalation. That's why mainly whenever we talk about the air quality and its related health problems, the first thing comes that its direct impact on the respiratory diseases. So here in this lecture, we are going to discuss one by one disease, how it is exacerbated and aggravated due to the climate change. So, increased air pollution due to the climate change. We know that increase in global temperature is going on consistently, it is continuing due to the climate change. Due to this, air quality is also impacted. This air quality is impacted due to the greenhouse gas emissions, and the major cause of greenhouse gas emission is the burning of fossil fuels which releases these greenhouse gases like carbon dioxide, methane, oxides of nitrogen, etc. Not only this, if we are talking about the air quality, how can we miss the particulate matter? The particulate matter are the generally solid particles. They are of different sizes. Like we talk about the PM10 particulate matter of 10 micrometer. We talk about the PM2.5 particulate matter of 2.5 micrometer, which can be easily inhaled through our respiratory system, and it causes severe harm to the respiratory system. So talking about the particulate matter, like certain events like wildfires, which is aggravated by the climate change, and even increased in the industrial emissions, vehicular exhaust, these all events causes contribution to the fine particulate matter, particularly PM10 and PM2.5 in the air. And this specifically this PM2.5 is of aerodynamic diameter, which can be easily inhaled by the human being, thus causing several respiratory problems, maybe in terms of acute lower respiratory infection, upper respiratory infection. It can even aggravate the problem of chronic obstructive pulmonary diseases. Asthmatic patients can also have some problems due to this particulate matter. Not only the greenhouse gases and the particulate matter can cause severe problems to the human health, even the ground level ozone, which is also, we can say, the high temperature is leading to the increase in the formation of ground level ozone, which is a very harmful air pollutant. What are the health impacts of this poor air quality? Some of, although I have discussed here, we know that exposure to this air pollution directly it aggravates the chronic respiratory diseases like asthma. High rates of asthma attacks may be possible due to the airborne pollutants and allergens. Even the chronic obstructive pulmonary diseases may worsen due to the symptoms and progressions, mainly individuals having already suffering with COPD, that is chronic obstructive pulmonary diseases. The individuals may also feel some type of allergies. Like climate change increases the pollen season, leading to the more severe and prolonged allergic reactions. Many times the long-term exposure, particularly to the toxic gases, or we can say to the fine particles, specifically PM2.5, the particles of aerodynamic diameter, is directly linked with the highest risk of lung cancer. So overall, we can say this toxic, whether we are talking about the toxic gases or the particulate matter, they are responsible for several respiratory diseases, and these respiratory diseases and air quality, I can say, is mainly deteriorated due to the exacerbating impacts of the climate change. Let us see this diagram here, students, which depicts the air pollution and says it is a silent killer because slowly and slowly, but we can say in much aggravated form, its impact can be seen with the time. If we see some of the facts, here you can say every year around 7 million deaths are due to the exposure of both outdoor and household air pollution. You must be thinking, what is household air pollution? Here household air pollution is just discussing about the indoor air pollution. We are even exposed to the pollution indoors, and there are several sources of that. Maybe the building materials which is used in the construction of the building, maybe the floors, maybe the, we can say, the room freshener, pesticides, insecticides we are using. Many times the type of energy is used mainly for the cooking, maybe it is solid fuels or etc. that causes indoor air pollution, and many times generally we this indoor pollution remains least noticed. So I just see the facts here, student, that 7 million deaths are due to the exposure from outdoor and household air pollution. It is a matter of concern. Even the air pollution is one of the major environmental risks to the human health, and by reducing this air pollution level, we can even reduce the different types of stroke, we can say, like brain stroke, heart diseases we can reduce, even we can reduce the lung cancer and both chronic and acute respiratory diseases including the asthma, because due to the pollution, asthmatic patients' respiratory systems becomes very much irritated, and the symptoms can be seen in various types. If we see the regional estimates according to the WHO regional groupings here, you can see by analyzing these data facts, you can just have the understanding about the severity of this air pollution. Like if we talk about some of the regions, Southeast Asian region, over 2 million people are being affected. In Western Pacific region, if we talk about, here also over 2 million people are being affected. Nearly 1 million is affected in the Africa region. About 5 lakhs, more than even 500,000 people are impacted in East Mediterranean region, and even 500,000 people's deaths have been recorded in European region, and even more than 300,000 in the region of the Americas. Just analyze this, how you can now think how much important is clean air for the health. So it is a matter of great concern with the change of the climate change. Now, talking about the vulnerable population, who are the people who are more susceptible to this air pollution, or we can say the air pollution which is exacerbated by the climate change, mainly the elder ones and the younger ones. These are the more susceptible section of the society of the population. Mostly when we talk about the children, why they are more susceptible to the air pollution? Because they are having the developing lungs. The lungs are in the stage of development. They generally have the higher respiratory rates and the outdoor activity. So they are more susceptible and they are more exposed. Talking about the elderly, even the increased risk of respiratory and cardiovascular issues mainly exacerbated in the pre-existing condition. Already the people who are suffering from some respiratory ailments. Even if we talk about the urban population, because we know How we identify urban? Urban areas are generally identified by the high density of population, high density of the built up structures like the residential building, commercial and industrial complexes, etc. So people mainly living in the densely populated cities, they face a higher exposure because of high number of industrial activities, because of lots of traffic emission, and even because of decreasing blue and green infrastructure. So they are more at risk. If we talk about how the climate change amplifies the respiratory disease burden, so as we know, the wildfires are mainly exacerbated by the climate change in various regions. Some of the examples even we have taken further in our lecture, like in Australia, we will talk about how this climate change is aggravating the wildfire. So more frequent and severe wildfire, it releases large quantities of smoke and fine particles to the atmosphere, which leads to the respiratory distress. Similarly, if we talk about the heat waves, uh, we know that due to the climate change, the number and even the severity of the heat waves is increasing day by day. The prolonged heat period generally worsens the air quality by increasing the smog condition, by increasing the ground level ozone. The smog condition very much visible in November, December and January in the Delhi and Delhi NCR region, you must have observed. So actually these heat waves worsens the air quality by increasing the smog and ground level ozone, further which stresses the respiratory system. Climate change, we know that it also increases the extreme weather events like dust storms. We talk about the droughts, and even various other events like storm surges, hurricanes, etc. So which elevates the airborne pollutants, which again increases the risk of respiratory problems. Thus, so this is one of the example how the air quality, mainly that is impacted by the climate change, affects the human health. Let us take another example like heat related illness due to the climate change. We know that due to the climate change, global temperature is on rise. The frequency and intensity of the heat waves have increased a lot. Even we have given the data in previous lecture, which is posing a great health threat for the human being. Some of the common heat illnesses, if you observe, is generally the heat exhaustion, where the body loses excess water and salts due to the prolonged exposure to the high temperatures, which is known as heat exhaustion. So, similarly, if we talk about the heat stroke, it is a medical emergency where the body's ability to regulate the temperature fails. Means body may not be able to regulate the temperature, which may cause damage to the various important body organs, and even sometimes it leads to the death. Another important heat related illness is the dehydration, very much common among the elderlies, even among the younger ones, where the loss of fluids due to the sweating occurs. And this loss of fluids and salts due to the sweating leads to fatigue, leads to confusion situation, and even in severe cases it also leads to the organ failure. So these are the few of the health outcomes of the heat related illness, we can say. Let us see this graph, which shows that each decade is hotter than the last. Particularly here, overall, if we see 2020 and 2016, where around 1.2 degrees Celsius hotter than the average temperature during the 19th century. Overall, by observing this line here, you can see here, it is showing the decadal range, and here it is showing the temperature rise. Then clearly it is observed that each decade is hotter than the last decade, which is again a great matter of concern. If it continues at the same pace, then the certain situations may become irreversible. Who are the vulnerable populations to this heat related illnesses, or we can say heat waves? Particularly, we know elderly, because they are not very much able to regulate the body temperature. It is a natural mechanism. When body ages, then it loses its certain ability to regulate the body temperature. Even if we talk about the outdoor workers who are very much exposed to the outdoor environment, particularly the laborers in the agriculture sector or in the construction sector, they face prolonged exposure to the heat. If we talk about the urban dwellers, we know that the urban areas are emerging as the urban heat island. And what the data says that the urban areas mainly they are having temperature difference with the suburbs and the surrounding areas around about 3 degrees centigrade to 12 degrees centigrade. So they are emerging as the urban heat island areas with limited green spaces and increased heat retention, because we know that these green spaces play a very important role in climate regulation, or overall we can say temperature regulation. And this less expanse of green space can make city residents more susceptible to heat related illnesses. So these are mainly the vulnerable population, whether we talk about the elderly, outdoor workers and the urban dwellers. Talking about the health statistics, what WHO says that it is around between 2030 to 2050, climate change is expected to cause approximately 38,000 additional deaths annually due to the heat exposure, mainly among the elderly people. So just you can understand how the climate change is exacerbating, aggravating the events of the heat waves, and how these heat waves are impacting the human health. Another example here we can take climate change and spread of vector-borne diseases. If we talk about this climate change, we know it is expanding the habitat, and not only the habitat but even it is expanding the season of disease carrying vectors like mosquitoes, ticks and the flies, because they generally breed. We know that these vectors generally breed in warmer and the humid condition, and due to the global rise in temperature and changing pattern of the rainfall, the climate change is expanding both the habitat and the season of the disease carrying vectors. Due to this rising temperature, we can say that there is an increase in the spread of the diseases like malaria, dengue, fever, Zika virus, Lyme diseases, etc. And why this expansion in the, we can say, habitat and the season of disease carrying vectors have been observed? Because of mainly two factors. If we talk about increase of temperature, rainfall and humidity pattern, which has changed a lot due to the climate change. The warmer climates, we know that they speed up the life cycles of the vector. Not only this, increased rainfall and flooding can create more breeding grounds, or even we can say stagnant water for the mosquitoes which are responsible for malaria and dengue, etc. If we see here the global distribution of major vector-borne diseases and associated vector, then you can clearly find that most uh, uh, popularly they are mostly found in the regions having warmer and somewhat, we can say, humid climate. And we know due to the rise in temperature and changing rainfall pattern, the expansion of this region is being observed. Let us talk about some of the regional example like sub-Saharan Africa. Increased case of malaria have been reported mainly in the highland areas that were used to be cold for the mosquito survival few decades before. Similarly, if we talk about South America, expansion of dengue and Zika virus transmission in the regions were reported where these diseases were rare. Talking about North America, mainly the Lyme disease is spreading in the northern US and Canada, which was having a bit lower temperature for the survival of these vectors. For example, as ticks expand, they are expanding their range. So what are the health impacts of this vector-borne diseases? We have seen the higher incidence of diseases in the cases of malaria, dengue, limes in the regions which were previously unaffected, or even the lower incidence were reported in these regions. There was increase in the mortality and morbidity according to the reports because of lack of immunity in these new regions, because these are the new regions of occurrence for these diseases. So the people have not developed a bit resistant to these diseases. So due to the lack of immunity in the new regions increases the severity of the outbreaks. Talking about the economic burden, greater healthcare cost due to the treatment and prevention of these diseases is also affecting the region, particularly the developing region, which cannot afford a high financial assistance for this purpose. Another direct example through the climate change and human impact can be seen in terms of the waterborne diseases. Why I am talking about the waterborne diseases? We know that due to the climate change, the changing pattern of rainfall is being observed. Somewhere the drought condition is increasing, somewhere the flood situation is increasing. So, firstly, let us talk about the increased intensity and frequency of the floods. Because of heavy rainfall in some regions, flood situation arises, which leads to the contamination of fresh water sources with certain pathogens and the chemicals. Now, these flood waters often even carry the sewage, industrial waste, and the agricultural runoff, which increases the risk of the waterborne diseases. Not only the changing pattern of rainfall, but even the rising temperature that also create the conditions for the growth of the various harmful microorganisms like viruses, parasites, bacteria, etc., which again causes another health impact. This situation creates certain health problems like cholera, which is very much reported in the warmer regions where having the warmer temperature, particularly cholera is reported due to the polluted water sources, and it is associated with the outbreaks of cholera, especially in the coastal areas. um, if we talk about the waterborne disease, the next very common disease appears, that is a diarrheal disease. Flooding situation, poor sanitation situation, this leads to the increase in incidence of diarrheal disease, mainly in the low income regions with inadequate water treatment. As we know that contaminated water sources, they also leads to the outbreak of certain severe diseases like typhoid and hepatitis A, which also impacts human health to the greater extent. You can find here the regions with the suspected cholera cases. This colors are showing, different colors are showing the suspected cholera cases, and the circles of different sizes, these are showing the cholera deaths. Now, lastly, let us, when we were talking about the air quality and the respiratory diseases, then even we have talked about the heat related illness, and even we talked about the waterborne diseases and vector-borne diseases. There is another problem which is on rise due to the climate change, to which we are generally neglecting, that is the mental health impacts. Let us talk about that. Many times the worry about the climate change, thinking about the future of the planet, a fear is being observed in the younger generations that leads to the climate anxiety and eco anxiety. This situation is very much popular among the younger population, who generally feel overwhelmed by the scale of climate crisis. So this is another problem. This is health impact due to the climate change which is on rise. Even we can also talk about the post-traumatic stress disorders, talking about like natural disaster like hurricanes, floods, wildfires, that can lead to post-trauma. The peoples who are experiencing this type of disaster, and these type of disaster lead to the long-term post-traumatic stress. The people generally feel anxiety in various situations. They have the feeling of depression. Many times the survivors often experience this post-traumatic disorder with the long-term psychological effects and the behavioral effects. Depression and grief are also generally observed when we talk about the mental health related to the climate change. Emotional distress like loss of homes, loss of livelihoods, community structures, this lead to the depression situation among the people and the society. Talking about the solastalgia, it is a term which is generally used for the emotional suffering which is mainly caused by the environmental change or degradation in one's home region. So, solastalgia is also being observed in various people who are affected by the severe weather events which is exacerbated by the climate change. Even many types of health inequalities are also being observed. Some of the community nations can adapt to the changing situation because of the access to the resources, and many of the low income group nations, we can say low income communities and some sections of the society, they cannot cope up with the changing situation of the climate. So basically this leads to the situation of inequality, particularly the low income communities. And if we talk about the indigenous people and the vulnerable population, what I have said, they are facing higher psychological stress because of limited access to the health resources, and even we can say disproportionate exposure to the climate risk. So this is just I wanted to talk about the mental impacts of the climate change, because these situations are on very much I can say rise regarding the health impacts due to the climate change. So that's all for today's lecture, student. Have a nice day. Thank you.